Hello. I don't have any clue what's going on with my intro, but I'm not going to wait for it to load. So might just pop up in the middle of this, but whatever. It was going to play. There, it finally worked. Anyway, forget all that. I found this paper and it's 50 something pages. I'm not going to read the whole thing, but I did want to read parts of it because I found it somewhat interesting. So this was, and let me make it big. We'll go this way. Okay, so this was a research paper from the antiviral research. It's from 2002, 2002. So it's a bit old, but there were just a few things I found really interesting. It says the current research on respiratory viral infections, fourth international symposium. And it's got some names of some people there, some universities and things that got involved. So we've got Virginia, Australia, so the USA, um, Charlottesville, Virginia, USA, Melbourne, Australia, medicine, technology, what is this? Uh, London, the UK, London, UK, and the Netherlands. And the Netherlands pops up quite often, but in these research, these are the ones that universities typically see a lot of when doing these. So this is their thing. But let me pass this part. So we have an introduction. I'm just going to get down to the interesting things. You can see here, there's a list of universities over here that, are involved, people from these places that have showed up. Okay. And then you also have some pharmacy companies, the armed forces, Hong Kong is there. You've got a few there from different places. So if you go down here, you'll see after they've told you all of the places that are involved, St. Jude popped in, you get this educational grants for this meeting. Now let's just read them. Educational grants for this meeting were provided by Agoran Pharmaceuticals, Inc., a Pfizer company, Biota Holdings Limited, Eli Lilly and Company, GlaxoSmithKline, ID Biomedical, Janssen, MedImmune Inc., Ortho McNeil Pharmaceuticals, R.W. Johnson Pharmaceutical Research, Solvay Pharmaceuticals, ViroPharma Inc., White-Lerde Vaccines. These are the places that have given away grants for this meeting. All pharmaceutical companies, right? So they have a serious investment in these studies. So it goes on to talk about a little bit about the epidemiology impact and the impact there, living with rotaviruses. So life with the rhinovirus, sorry. Over what is now 40-year career, I've enjoyed a sustained interest in acute respiratory disease and specifically in rhinovirus. I graduated from the University of Virginia School of Medicine in 1956. That same year, Dr. William Mogadabag wrote, working at the Great Lakes Naval Training Station, reported the discovery of the first rhinovirus strain, 2060, later numbered as rhino. Is that the year it's going to come back? No, that's its number. Later numbered as rhinovirus type 1A. Earlier, there had been important epidemiologic studies into colds conducted in England by Dr. Christopher Andrews and David Tyrrell, and in the United States. But these studies were seriously hampered by a lack of virology, and the discovery of rhinovirus added greatly to the ability of investigators to study colds and also became an important influence in my career. And so he goes on to talk about how all the awesome things that he's done. Well, we're going to go down a little bit further. He says, Dr. Jordan and I began a study of acute respiratory disease in the approximately 500 employees of the Eastern Regional Office of the State Farm Insurance Company. This work was supported by the Commission on Acute Respiratory Disease of the Armed Forces Epidemiology Board and the Vaccine Development Branch of the National Institutes of Allergies and Infectious Diseases. The insurance employees maintained daily symptom records and supplied specimens for viral culture and serology. The study eventually continued for 15 years. A nurse monitored the employees on a weekly schedule to ensure accurate recordings of data. And in this study, which employed cell culture for viral identification, rhinovirus accounted for 25% of the colds, giving a rate of 0.77 rhinovirus colds per person per year. And this attack rate was consistent with that of an earlier study of young adults conducted in Chicago by Dr. Dorothy Hammer. The age-specific rate, that was in 66. Rates of infection were higher in children than in adults. And a seasonal variation in rhinovirus attack rates was also observed in the Charlottesville population, which resulted in a consistent large fall peak of illness associated with rhinovirus. Of interest, this yearly rhinovirus outbreak coincided in time with a recurring peak of respiratory illness identified 20 years earlier by Dr. Frost, a graduate student of the University of Virginia and the first dean of the School of Public Health at Johns Hopkins University. I have a rainbow wheel of death. I'm not sure if that means you can hear me or you can't hear me. So never know what to do. If you can hear me, don't worry, I won't be reading this whole thing, although I would, recommend those that are interested do. Or at least take a peek at it and scan through to see if things catch your eye. But I'm trapped now. I think my computer has said, that's quite enough. Dr. Papers, Joni, you're not supposed to be reading these things. You're in the wrong part of the library. Your clearance pass does not give you access to the medical section of the library. Why are you over here? I can't help myself. I'm a nosy person. But I want to go down and I want to read, if it's going to do this whole time. There's a great section about washing your hands or using some type of chemical to remove germs from your hands. And the reason that I wanted to share this was, one, I wanted to show you who was funding this. So there's clearly a conflict of interest, despite the fact that they say there's no conflict of interest. There is. If pharmaceutical companies are funding these, then pharmaceutical companies are the ones that are going to use this information for selling you things. Now, are pharmaceutical companies good? Of course they are. Why not? They get rid of my headaches, they cure my cancer, but they also have opposite side where I believe that they experiment on people. And people don't realize that necessarily. They do, it says that, but then they don't. It doesn't say that. Do you know what I mean? But anyway, I'll just kind of, if it's not going to go, I can't move my mouse or even click. I can't even turn off the stream and start over. Basically what it says is that they did some tests and they found that washing with soap and water, just washing your hands the old-fashioned way, is the most effective way to remove these, quote, germs from hands. And then they went on to note a few other chemicals and things. Iodine was mentioned. They had asked it. Oh, I can move now. Oh, there we go. Okay, so I'll go to it. Look, just in time before I had said the wrong thing. Um, and just all of the people, here it is, that are right. So they talked about that are involved, all the different places that are involved. A lot of military is involved, a lot of medical, and a lot of insurance. This is the takeaway. Um, so they talk about how it's passed from person to person. We know all of these things. The reason I'm discussing this, because you might go, okay, boring, and click off because you already know this. This is important because the date 2002 is important. Okay, and I'll talk about why. It says with hand contact implicated as a possible route of rhinovirus transmission, prevention became the next issue of interest, and studies were conducted in which rhinovirus was applied to the subject's hands, and the hands were then treated with a variety of different types of commonly used sterilizing agents. And this was done in 1978. Washing the hands with soap and water was found to effectively remove the rhinovirus. It worked. However, most of the chemical agents tested did not provide the desired long-lasting virudical activity on the skin. Solutions with low concentrations. So they're trying to find something that will, after you've put it on your hands, you can wash your hands, that removes it right away, but you might touch something else. This is what I'm thinking. And if you remember, those of you that might have had kids during this time, so a lot of people were having children, generation was having children during this time. They started to come out with about 10 years later. So I think it was around 2010. You started to see antibacterial toys, antibacterial high chairs, antibacterial objects that, things that your baby might play with that, holds, keeps bacteria from sticking to it, is how the commercial sold it to me. That if I didn't get the high chair clean real good, don't worry, it's antibacterial. So no bacteria is going to, this was also 2002 was also the height of hand sanitizers. So an entire generation was completely hand sanitized. Wipes were used on children's hands. And baby wipes were used on children's hands and faces at daycare centers all across the world, I imagine. And I had a big problem with this. In the mid 90s, early to mid 90s, I was in college and I was working at a preschool. And this is where we started to see baby wipes being used. And I was really grotesque. Hand sanitizers, not as much, but baby wipes for some reason were being recommended. And I can remember going to the park one specific time. There was a different teacher than me there with me. And I had every one of my little children lined up to go into the bathroom to wash their hands so we could eat our sandwiches. And this other particular teacher decided instead to use baby wipes to wipe the dirt and the germs off of their hands. And it was at that moment that I recognized something and I saw a glimmer into the future. And then I started seeing it everywhere. Everywhere you went, there were teachers and parents wiping their children's hands, which soon turned into a dab of antibacterial, gel of some sort, which the kids then ate their sandwich with tons of it on their hands. And I just remember thinking, one, that was gross. Two, you're wiping off dirt. You're not wiping off any germs with a baby wipe. So that's kind of pointless altogether. And two, you're then using a hand sanitizer to remove the germs from the hands you wiped the dirt off of. In my mind, it was faster and more efficient to just line them up into the bathroom. And in their minds, that took longer. They could, it was a 15-minute process to wash hands in a bathroom, and it was a 5-second process to pass out napkins and squirt gel into their hands. So right there, I started to see something new coming in. And I decided that I was not going to be one of those teachers, that I, in fact, wasn't going to be what I, at the time, labeled a lazy teacher, that I would take the time for my little wee ones' benefit to line them up and let them all wash their hands, as opposed to baby wiping it. And so I did that. And that's why this was really interesting to me, because I was right there taking pictures and mental notes at the time where this was being discussed, this was being suggested, this was happening live and in person. And so they say that however, most of the chemical agents tested did not provide the desired long lasting is that virucidal activity. Crucial. I'm thinking, I don't know what that word means, but in other words, it doesn't last forever. It doesn't last long enough on the skin. And solutions with low concentrations of elemental iodine were found to be the most effective and were able to keep hands sterile for up to 4 hours. This was done back in the 70s. That was done in the 80s. And remember the generation of pour iodine on it, right? Using iodine hand treatment as a method of prevention. I also believe that iodine was used when doctors would scrub up, if I'm not mistaken. A control blinded contract prophylaxis study was then done, in which mothers of families were instructed to use iodine to treat their hands on a regular basis when a family member was recognized as having a new cold. That was 1988. A control group of mothers treated their hands with a solution containing brown food dye with a small non-virucidal amount of iodine. Approximately 50 families were studied from each year, from 1979 to 1982. On 4 of 58, so 7% of the mothers, and the mothers, your mother was a mother, in the iodine hand treatment group, compared to 16 or 79 16 of 79 or 20% of those in the placebo group developed colds after exposure to the index case of the common cold. So it helped lower that. None of the 11 iodine treated patients, compared to 5 of 16 of placebo patients, became infected with the rhinovirus type that was introduced into the home. By the index case. By interrupting viral transmission by treating the hands, it was demonstrated that the hand contact self-inoculation route of rhinovirus transmission was not only feasible, but occurred under natural conditions. Thus, it appeared that accidental rhinovirus introduction into the nose could have been prevented by hand washing and avoidance of finger to nose and finger to eye contact, and was probably practical value of avoiding colds. Okay. So clearly we understand that children are germ spreaders, right? Because they touch everything, everything goes in their mouths. They're always rubbing their eyes. They got dirt in their eyes. They're sticking their fingers in their mouth. They're smelling things. So this is a problem. Now, a human being's body is in fact designed to come across such agents, create its own version of a cure, and then helping the body along further down the line as we develop and grow up. That's why children are lower death rates when it comes to things. They're in a way invincible for a while. They really can take a licking and keep on ticking. And they're designed to do that. Their elementary school, or their first adolescent, not adolescent, but childhood, the first 18 years of their life is surrounded by new and exciting things. And so God made sure that the body could, in fact, take on every one of these challenges. However, when we started sanitizing our children, which was roughly around the 2000s, something happened and we started to see different scenarios playing out. And it's my understanding that we have sanitized ourselves into sickness. So by not just doing natural things, wash up before dinner, you know, um, wash your hands in the creek if you can, by trying all of these different things and antibacterials and germs on your high chair and toys that don't and the whole nine yards, everything that sounded really possibly excellent for a minute, and we were all like, yes, our kids won't get sick now. I think we have a world full of people who are going to get sick, is what I'm thinking. If God's way hasn't been able to work itself effectively, because we care about our children, we don't want them to be sick. We don't like, and every parent that's had a sick child knows exactly the heartbreaking when they're crying and they can't breathe and there's just nothing you can do. These days they just rush their kids to the hospital and sit by the bedside and enjoy all the attention they're getting. But there was times, the doctor's office and get medications. But there was a time that, unless the cold that your child had, I remember calling the pediatrician because my kid would have something, and I would just call the office. And in the days when your doctors knew you, and I would ask my doctor's specific nurse, or if she wasn't there that day, one of the other doctor's nurses, and I'd say, look, my kid's got a cold. Here are their symptoms. Is this something I need to be worried about? And they would go, no, that's going around. Give them lots of fluids. If the fever goes over 103, give us a call back, etc. They would go through all the steps. Or they would say, yes, we're having a case of this hitting the kids. So come in, let's do a little swab and we'll see if we need to give an antibiotic. So I could avoid most doctor's visits because a call would tell me, yep, that's going around, stay home. Yep, that's going around, come in, we need to see if they need antibiotics. Okay. And then once it got into the phase of you didn't have a choice, the minute you called, they wanted you to come in. And that was insurance. That was when doctors' offices started bulking together, and trying, insurance companies were forcing doctors' offices to take on multiple amounts of patients, and there were multiple doctors. I mean, I saw all that happening. And that's when that started to change. That's when I no longer had the ability to call the doctor and just ask. I did, but I didn't. It just depended on, you move and then suddenly things change. Either way, they wanted to see him. And then they're bringing him in doctor's offices where they divide. When we divided the pediatrician's office from the sick side to the well side, I have to come in for my well check, but I don't want the well children sitting over here by all the infected children. So I'm sitting now in a side of the office that's only divided by the secretary's desk, really. So, I mean, how much division is that enough? I've touched my kid, and now I'm touching the same pen that the well visit mom is going to you pick up in order to write her name down. Do you see how silly this was? But I'm over on the well side, and I didn't know what that kid has, right? All I know is that my kid has a fever. This kid over here is sneezing up a storm. That kid over here is coughing up a lung. And I'm there. Now, I don't know if those kids have the same illness my kid does, but if my kid's immunity is low right now because they're not feeling well, and they're in a room next to kids who have other infectious diseases that mine does not have, we've created a problem. So that's why I like to call first. I don't want to come up there and sit there if I don't need to. That's horrible to do to my child. I find that to be somewhat torturous to them. I don't want to do that. But anyway, this is about 40, let's see, it's 52 pages. But it does just have some very interesting, you know, kind of historical stuff. So things that are in here you can now see have come into play. So it's like a little time capsule of the future. They were talking about the future, detection and surveillance. Diagnosing these is complicated by overlapping clinical spectrum of infections and multiple detection methods with variable sensitivity and specificity. And then it talks about this PCR tests, widespread availability. That's the greatest improvement of diagnosis is the PCR. I think that's the little swabby thing they do in the nose, right? To find out if they, needed to put you on things. The use of a quantitative real-time PCR is in its infancy for respiratory viruses. So clearly we got quick on that in another 10 years or 20 years. Do you see what I mean? 2020, 20 years later, you could just go in for a quick view dipstick, the Quidel quick view dipstick influenza test was being used there. So we were having this show up. This was another thing I've talked about in the past in the case of sudden infant death syndrome. In the past, it's been shown that the incidence of SIDS syndrome has correlated closely with the incidence of acute respiratory disease in the community. In other words, there's a link. And so they have looked into that, which I've talked about that a few times. It's an adult death syndrome, right? Sudden adult. So here you can get, some other information, emerging pathogens, the pandemic influenza threat in East Asia. And so you've got Hong Kong, SARS, China, right? Something about some bird flus in there. But really, they're just giving you pathogenesis and immunology, the breakdown of what's to come. So when you see these in hindsight, you go, oh, well, there it is. There it is. They definitely were on it. So that means that the articles and these symposiums that are happening today are going to be telling you about the future. On my old channel, I had a video and there was a guy talking about the Ebola virus, and he was going through the list of things that they had in mind for the next Ebola outbreak, which at the time when they had the Ebola outbreak, the next one, they only used a few of them. They only used a few of these measures, but when the CV was going on, they were using a lot more of them. And so I asked the question, was this, a practice for the Ebola virus? Or was this just named Ebola virus, but it was just a practice? They changed the title of the film from Ebola to CV. That's what it sounded like to me. At the last minute, they go, no, Ebola, I don't like the name of that. We're going to change the name. We're going to call it the pandemic, the 2020. Just change that. Anyway, let me get down here and then I'll shut up. So I'm sure doubt very few will follow this through. I don't blame you. I don't necessarily want to, except I just find it somewhat interesting anymore. So I can't look away. I'm turning into a pillar of salt. Let's see. Here's a new influenza vaccine that they're talking about that goes into the nose back then. H1N1. This is where they were practicing these things. They've got some clinical features, predictive values. Okay. Let's go down. I'll go on the side here. Oh, okay. I've got a lot. Half of this is going to be pages citing people, all the people involved. Let's see. Here's another one. Does anybody remember this word? Rupreiter-Ivor. Rupreiter-Ivor was tested. The study failed to find significant differences in the mean respiratory or total symptom score that day. 1 through 5, or in the time of the resolution of respiratory or cold symptoms between this and the placebo. They were talking about that there. And in summary, it says the 4th International Symposium on Respiratory Viral Infections was successful in summarizing the recent advancements in respiratory virus research, advances in the understanding of the epidemiology and the pathogenesis of RSV, influenza, parainfluenza, and adenovirus were discussed. It is clear that there is emerging evidence that the 1918 influenza virus is derived from an avian precursor, but that it probably adapted to humans soon before the pandemic. And the introduction of novel strains of influenza from the region around Hong Kong are concerning and may result in future pandemic. Influenza vaccine has been proven to be cost-effective in most patient populations. Several studies have shown that respiratory viral infections can be differentiated by clinical presentation and that rapid diagnostic tests are aiding in the diagnostic process. Respiratory viruses have clearly been implicated in the pathogenesis and frequency of AOM. The HMPV, most valuable player or player valuable, has recently been discovered and appears to be a common pathogen in man. Our understanding of this virus is in its infancy, and future studies on the epidemiology, pathogenesis, and prevention and management will likely be presented in future meetings. So you can look forward to that. There has been many advances in the field of respiratory viral vaccinology over the past year. An RSV vaccine has been studied in adults and appears to be safe and immunogenic. A parainfluenza virus 3 vaccine is also under development and appears to be safe and immunogenic. Influenza vaccines have been found to be cost beneficial in most patient populations and can therefore be recommended in all patients as long as the vaccine availability permits complete vaccination of high-risk patients. So they have to have enough for the high-risk patients. Notice how they do that. They always get first. Several intranasal influenza vaccines are either approved or far along also in their development. And the past year has been marked by the availability of new antiviral agents. The Flunit represents a novel dimer of zanamivir that has pharmacokinetic properties in animals that suggests it can be administered once a week. Several RSV fusion inhibitors, such as, have been developed. This class of agents is highly potent against both RSV A and B strains and is currently undergoing early clinical trials. 2 new classes of anti-picornavirus agents has been tested, and the capsid binder of some other word I can't say is well tolerated. It's well tolerated. An effective therapy for rhinovirus colds. This therapy, protease inhibitor of the rupatipidine, is currently being investigated as a highly potent mimetic what does that say? Irreversible, irreversible 3C protease inhibitor. The drug performed well in experimental human infections, but did not result in significant differences in the treatment of natural infections. So we should know that. It is still being investigated in different settings and with novel formations. Here are all the references. This is page 44. So the next 12 pages, no, 44, yeah, 8 pages is nothing but references. So you can have a lot of references where all of the information came from. Anyway, those are just my thoughts on this article. That's it. I don't have anything else to add. I can delete it now from my tabs, and hopefully this recorded, because I won't read it again. I'll just say, get it. So back to my studio now. And I will say goodbye. But I have the rainbow wheel of death again. So waiting for that. Okay. What kind of thoughts did you have? I know I only read through the parts that kind of stuck out to me. You know, I didn't pick this apart with a fine-tooth comb or anything like that. What I really did was just kind of scan and picked up on things that I can remember, you know, like the hand washing movement and antibacterial and so forth and so on. And I also found it really interesting that you're constantly finding research papers saying things like there's no conflict of interest, there's no conflict of interest. And that right there should tell you something, because that group may not have any conflict of interest, but the university that they are working for, or the wherever they're working for, has direct ties to these major corporations. So maybe not directly, but indirectly, there's a conflict of interest, you know? So it's hard for me to believe the things that they say. When they say, well, we don't have no pharmaceutical paid for my personal research. That's 100% true. But they did give grants for certain professors to go to symposiums. And that's a conflict of interest with the information that you provided during your research paper. Do you see what I mean? That's what I read. So it's these kinds of things that have me shaking my head. But anyway, maybe my outro will work since my intro didn't. Thanks for listening to me. Share your thoughts.